everybody, I'm from Port Macquarie and I'm a low-carb GP there, and I'm going to tell you about the amazing life that I have as a low-carb GP. All right, okay, so all GPs, we sit there every day, it's like a cliche. You get the very unwell, chronic disease patient, everyone's on the same, 5 drugs, everyone's got reflux, everyone's obese, everyone's diabetic, everyone's got sleep apnea. The pain list, they're on Lyrica. And you just sit there and you don't know really what to do, and their knee hurts. What can you do? But I used to just feel desperate. But now I'm just so happy. Every day I just stop drugs. That's all I do. And I can honestly say this is the most amazing thing I have ever done in medicine. It is incredible. And in my town, it's quite small, so everyone knows each other. So people are going, oh, what's Penny doing? And they'll see my patients, or the cardiologist will see my patients, the gastroenterologist, the anaesthetist, and they're starting to send me patients because they're seeing it too. So before I knew lifestyle didn't work, I'd go to the conference and I'd just roll my eyes when they said, try lifestyle first, and if that doesn't work, use the drug. But I was there to learn about the drug, the side effects of the dose, because lifestyle didn't work. Now it's the opposite. I know lifestyle works. A low-carb diet works amazingly. So I just look at the list, they come in, I go, great, let's get rid of the insulin first. That's usually gone within 48 hours. So my record is 140 units in 36 hours. That guy's a year and a half, is still off his insulin, HbA1c 5.6. Blood pressure medications that you just stop them. What about reflux? I had a guy the other day who went, I'm so good since you've stopped that diabetes drug, my reflux is gone. And you go, no, it's just the diet, and I've stopped, it's just a coincidence because the diet fixes it and the pain gets better. And I feel it's like cleaning out the cupboards. That list just shrinks and shrinks and we hardly have them on anything at the end. I find it easy to teach. I don't know, my patients are just Port Macquarie people and they're good with a barbecue. They find it easy. And they get such fast results that they're happy. So I'm going to tell you about this wonderful lady called Mary. So the kidney specialist is sending me patients, and she's 75. She's got stage 4 chronic kidney disease, so quite severe. I put her on a very low carbohydrate diet. I always pretend I'm Dr. Westman, so I do his diet. So she was off her 20 units of Lasix within 2 days, as everyone is. I've since stopped 2 blood pressure medications and also her reflux tablets. She's lost 10 kilograms in 15 weeks. Her HbA1c's dropped from 8.6 to 6.7%, so that's off insulin. Her EGFR, if you're a doctor, you will think this is exciting. Her EGFR was below 20 for the last 2 years. Now it is 30, it was 27 the last one, so it's 24, 27, 30. So I think that's so exciting. And the other thing is, when she came back at 2 weeks, she said to me, my legs aren't swollen anymore, I can clean between my toes. And this is why being a low-carb GP is fantastic. This is the email she sent to me 5 days into the diet. So I always give them my mobile and my email because we're fiddling with their pills. And she sent me this email. Last night my blood pressure was low. And this is a kidney patient on 1 million blood pressure tablets. It was, 95 on 58. And I thought, gosh, something wrong with my blood pressure machine. I changed the batteries. It was still low. Then I had the best sleep that I'd had in a long time because, low carb, everyone feels better. But it was still low, and she's lost weight and she's really happy. But that's 5 days in, so I ring her up and go, stop your 40 milligrams of Lasix, please. Because low blood pressure, of course, is terrible for kidneys, and she's already got delicate kidneys, so I was terrified we were going to make it worse. So there you go, within 5 days off 40 milligrams of Lasix, and we also halved one of her other blood pressure tablets. There's another guy, Robert, he came along, he's got CKD as well, and he was on 1 million, 3 diabetic tablets, his sugars were 14, he was looking at insulin, he was desperate, didn't know what to do. And he's an old guy, he lives on his own, he can do this, okay? 8 months in, low carb, lost 14 kilograms, stopped 2 diabetes meds, blood pressure great. And look, when he came in, his blood pressure's 203 systolic on a lot of blood pressure medication. Now it's always like 125, just beautiful blood pressure. And again, his kidney function's improved a bit as well, 38 to sitting in the 40s, and his urine albumin's halved. And look at the HbA1c, it was 8.4 on a whole lot of pills, and now it's 6.2. So what about insulin? I love patients on insulin, type 2 diabetics on insulin. I just get excited when they come in because it's fun. I've stopped 15 patients off their insulin, so it's almost boring now, like ho-hum, here we go, let's stop it. So I told you about my bloke 140 units, and look, they are off it within 2 days, and I told the cardiologist, oh yeah, they get off it, in 2 days. Oh no, it's the weight loss, I don't know what's going on in their heads, it's 2 days. And the patients cannot believe it. They just can't. The guy went, I'm off my insulin. I don't understand the science of this. What's the science? There is no science. You're just not eating glucose anymore. It isn't very hard. And they go, why has no one told me this before? Especially the patients on insulin who have got kidney failure. If someone had told them this, 5 years ago, they wouldn't be there. And they find it easy, and the insulin people love it. They'd much rather not eat bread than inject themselves. So checking results as a low-carb GP is fun. I love it. I get really excited. I'm always ringing patients halfway through. Can you believe it? And there's HbA1c, drop 7.2, and triglycerides. Before I did low carb, I didn't know what to do with triglycerides. You'd put them on a pill, but they'd still be high. And I'd Google it, and they'd go alcohol, cut the alcohol, tell them to exercise more. Why didn't anyone say don't eat grains, potatoes, and sugars? This man here, his triglycerides were 5.4, and that is on medication, and on a low-carb diet, 1.1. Look at that, and the HDL pops up as well. Look at the liver function tests in red. That you just check them, oh yeah, they're doing well, triglycerides down, liver function's great. And in the past, as a GP, everyone's got fatty liver. You spend your life doing ultrasounds, looking for hemochromatosis, but look, just tell them not to eat grains, potatoes, and sugars, and within 6 weeks, they're cured. And as I've said, in just a few people, I have been finding their kidney function is improving. My husband is a urologist, so he does all this deep surgery in kidneys and prostates, and his life is desperately hard with obese patients, and he's been trying to get them to lose weight. So I would come home so excited, telling the whole poor family over dinner my latest exciting story. And he said to me, can I do this too? Let me have your diet sheet. And so he now, when he's consenting a patient for surgery, he will spend an extra 5 minutes. He'll take them through the Diet Doctor visual guides, and he'll give them a handout. And he has found, he's keeping the records, it's even more patients now, but 56 out of 57 patients have lost weight when it comes for surgery. They've got cancers, they're really motivated. And he says even within 2 weeks, they've lost weight, and it makes a difference because it cuts down surgery time, and it makes his life better and less complications for the patients. Most patients are losing up nearly 10 kilograms, and he says to me, I save more lives with this diet than any operation. And he also notices what I notice is that you treat 2 people at once because the husband and the wife both lose weight. So I actually now take a diabetic tablet history from the partner because you end up going, oh my goodness, they're on an SGLT2 inhibitor and they're going to have diabetic ketoacidosis because I didn't stop it. So I usually do 2 for the price of 1. This is my husband's results, and they're going to be his registrar will be presenting this at the Royal Australian College of Surgeons meeting in May, just saying to surgeons, why don't you try this? It takes 5 minutes. So what about chronic kidney disease? So chronic kidney disease, the common causes are diabetes, obesity, hypertension, and if we don't slow it down, patients end up on dialysis or with a kidney transplant. So our management is keep the risk factors under control. But at the moment, the poor kidney people are told you've got to limit protein and you have to limit fat because your heart, and don't have salt. So what are they left with? They're left with bread. And what are the risk factors? Diabetes, obesity, and hypertension. So it doesn't make sense. It's silly. It really is silly. So the kidney doctor in Port Macquarie is amazing. He has such an open mind. Now, initially he was a bit worried about what we were doing because he sees my husband's patients. He's going, that's a bit high protein. But then he saw the results and he rang me and he said, let's do a study together. I'm going to send you patients and let's do this together and see what happens. So I emailed Eric Westman and he replied. I was pretty excited. I've had a few emails with him, so I'm excited. And he linked me in with some doctors in America who are doing the same thing. So there's a guy called Hugh Adams, who's a nephrologist at Rochester University, and a professor who's a family physician who works with Dr. Westman and looks at his data, and at Duke University near Mitchell. So we email each other, and Hugh has a clinic once a month where he sees obese diabetic patients and puts them on a ketogenic diet, and he's got 60 patients. Says he hasn't seen any problems yet using the diet, and he uses Dr. Westman's protocol as well. So for me, I've got my 16 patients and I'm monitoring them carefully, and they're losing weight and their diabetes is getting better, their blood pressure's dropping, and Mary was one of the first ones that did really well. But I just want to say it is so important. If anyone's got chronic kidney disease, you do not do this by yourself, particularly the people with the severe kidney disease. I find they get a real, they're already on diuretics, and then the ketogenic diet is sort of diuretic in itself, and their blood pressure just drops through the floor. And again, you can cause an acute kidney injury if you're not pulling out those tablets fast. So that's what I've learnt from just my few people. So you can't do it, and I'm only doing it because I've got a kidney specialist holding my hand. Before this, I didn't even know how to use an Excel spreadsheet, but I'm so lucky my brother is an engineer, so he set up a table and I enter the data, and then he did a pivot thing for me, like made this fancy graph. None of it's analysed or anything, but I've got a medical student this year who's going to help me, and maybe we'll manage to publish something, who knows, a case series. But this is everyone's blood pressure, and I don't know, that looks like it's dropping to me, and that's on less pills. This is their BMI, everyone looks like they're losing weight. And, oh man, what's going to happen to the kidney function because of the protein, the protein? Well, that to me looks like it's trending. It's definitely not trending, down, and you can see some people are improving, so that's looking all right. So what do I think? I know, Liz was saying, gosh, what's going to happen? We've all got to fight back. Who's going to fight back is the insurance industry, because they don't want to pay for the pills. And they are paying for the pills in America, and that's why Virta Health is now worth $2 billion, and they're going to reverse 100 million cases of diabetes by 2025. So thank you to them. Maybe capitalism will work in the end. The RACGP sadly said just at the beginning of this year, in reference to a recent studies on low-carb diet, they're a bit worried, potential danger and interaction with some drugs, and not everyone can do this, and they're all a bit worried. Here GPs learn about initiating an intensification of insulin therapy. That's how we earn our CPD points. We've already had that one. Now, in Eric Westman's words, it's so unbelievable, no one believes it.